to your health promotion and disease prevention podcast brought to you by Kike Afia. My name is Biri Obogo. I'm a medical doctor as well as specialist in public health medicine and the host for this podcast. Now, in this episode, I'm going to discuss 6 truths about colorectal cancer, or what some people call colon cancer or bowel cancer. Now, if you recall, February is Colorectal Cancer Awareness Month, and that's why we are discussing this topic today. So, in today's your birthday, I hope you have a fantastic one and many more candles to blow. I also want you to know that there's no better birthday gift than to be in good health. So do me a favor, if your friend, parent, sibling, spouse, colleague is having a birthday, I want you to check on them to see when they were last screened for cancer, blood pressure, blood sugar, pap smear, among others. You're also welcome to subscribe to our YouTube channel to learn more about using lifestyle changes to manage these lifestyle diseases. I'll be discussing the latest science on how to screen for and manage high blood pressure, obesity, cholesterol, high blood sugar, screening for and managing cancers of the breast, colon, cervix, and prostate. I'll also be giving tips on harmful use of alcohol and how to stop smoking, as well as road safety, among others. Now, according to World Health Organization, 80% of heart disease and 40% of cancers can be prevented if all individuals stop smoking, exercise regularly, cut out or reduced alcohol intake, and ate a healthy diet. Now, remember that wellness checks are appropriate for all age groups, from children, teens, as well as adults. Now, by the end of this episode, you should be able to describe the incidence of colorectal cancer and list 4 common risk factors for colorectal cancer. You should be able to explain the appropriate age for screening for colorectal cancer and discuss the appropriate tests. And then finally, you should be able to discuss the importance of knowing your family history of cancer and other diseases. Now, here are the 6 truths and myths. If you have a pen and paper, you can just tick whether it's true or false. And then I'll be discussing this in the episode and I'll give you the correct answers at the end. So first one is colorectal cancer is not a big problem after all. True or false? Second is it's possible to prevent most cases of colorectal cancer. You can just indicate if that's true or false. Third, if I'm feeling well, I don't need to be screened for colorectal cancer. 4, lifestyle choices such as alcohol, exercise, smoking, and diet have a significant impact on the risk of colorectal cancer. Then 5, most people should start screening for colorectal cancer at the age of 45 years. Just if that's true or false. And then finally, colonoscopy is the only test used to screen for colorectal cancer in persons without symptoms. So I'll be discussing this and I'll share the specific answers at the end. So here is a quiz for which I'll give the answer at the end. Excessive alcohol intake has been linked to the development of all of the following types of cancers except A, mouth and throat cancer, B, endometrial cancer, C, liver cancer, D, pre- and postmenopausal breast cancer in women, and E, bowel cancer in men. So there were an estimated 18 million new cases of cancer around the world in 2020. Of these, 9.3 were in men and about 8.8 were in women. So I'll be discussing this epidemiology more in the next slide. So the most common cancers globally are listed in the table above. Now, this refers to global cancer incidence, that is new cases in the year 2020, and this is for both sexes, male and female. So the first top 3 cancers were cancer of the breast, cancer of the lung, and colorectal cancer. Breast and lung cancers were the most common cancers worldwide, contributing about 12% for breast cancer and about 12% for lung cancer. Colorectal cancer was third most common cancer diagnosed in 2020. There were about 1.9 million cases diagnosed globally, and it accounted for about 11% of the total cases in 2020. Now, in this table, the figures for percentage are for all cancers, excluding non-melanoma skin cancer. Others, all other cancers are included in the total. Now, for more information, you can look at World Cancer Research Fund international data on the epidemiology of cancer globally. As I mentioned, breast and lung cancers were the most common, these two, breast and lung, followed by colorectal cancer. And breast cancer accounted for about 13% of the cases globally, while lung accounted for about 10%, colorectal cancer accounted for about 11% of all new cases globally. That was about 1.9 million cases diagnosed. So that goes to say colorectal cancer is a very important cancer. It's very common and we should not ignore it. Now remember, it occurs in both men and women. This is important to emphasize. 33% of all cancers are preventable through simple lifestyle changes. Of course, you know that cancer is a multifactorial disease, and you just can't take one risk factor and say that it's responsible for preventing or aggravating the cancer. Now, factors that affect the risk of cancer in general are food and nutrient intake, alcohol, smoking, breastfeeding, body fatness, as well as physical activity levels. So remember that your lowest risk of cancer will be at the intersection between the three factors, between weight, diet, and physical activity. So that's where your risk lies. Now, even though we don't know the exact cause of most colorectal cancers, we know that it's possible to prevent many colorectal cancers, mostly through regular screening as well as managing the risk factors. A regular screening is one of the most common powerful tools for preventing cancer of the colon and other cancers. Screening is the process of looking for cancer or precancer in people who have no symptoms of the disease. Regular screening can help prevent colorectal cancer by finding abnormal colon growths called polyps, so they can be removed before they have a chance to turn into cancer. You can also lower your risk of developing colorectal cancer by managing the risk factors that I've mentioned, such as diet, weight, physical activity, as well as smoking. I'll be discussing this in more detail in subsequent episodes. Now, you don't need to feel unwell to be screened for colorectal cancer or any cancer, and there are two reasons for this. One, testing before you feel bad can help you to detect the disease early, and it's easier to treat in the early stages. And then the other reason is that most people don't have any symptoms of colorectal cancer. So early screening when you're feeling okay is very, very important. But what are the symptoms to look out for in case you suspect colorectal cancer in advanced stages? There are several symptoms. One, a change in bowel movements. This can occur as either diarrhea, constipation, a narrowing of the stool. Usually it lasts more than a few days. The other issue is a feeling that you need to have bowel movement that's not relieved by going to the toilet. The other one is bleeding, either rectal bleeding, dark stools, or blood in stools. But remember, in many cases, the stool can look very normal. Belly pain is another sign of colorectal cancer, as well as weakness and extreme tiredness that doesn't go even with rest. And finally, of course, unexplained weight loss. Now remember, other conditions can mimic these symptoms I mentioned about. For example, an infection, hemorrhoids, something we call irritable bowel syndrome, or inflammatory bowel disease. So just because you have these symptoms, it doesn't mean that you have colorectal cancer. You could be having any of these conditions. That's why it's good to see a doctor for him to do the appropriate tests. Now, I did mention lifestyle choices have a big impact on many cancers, including cancer of the colon. The main ones for cancer of the colon are alcohol, your physical activity level, whether you smoke or not, your diet, and basically cooking meals at very high temperatures. Now, it's best not to drink alcohol at all, but if you have to drink, then it should be no more than 2 drinks per day for men and not more than 1 drink a day for women. I'll be discussing more about physical activity, but basically divided into 2, either moderate or vigorous intense physical activity can help reduce your risk of colorectal cancer. If you smoke, then you should stop. Any form of tobacco is not good for your cancer risk. Diets high in vegetables, fruits, and whole grains are protective, whereas diets which contain red meat, such as beef, lamb, liver, and processed meat, as well as sugary drinks, will increase your risk of colorectal cancer. Now, it has been shown that cooking meat at very high temperatures, such as frying, boiling, or grilling, might create some chemicals that help increase your risk of colorectal cancer. Now, the question of when should I start seeing colorectal cancer is very, very important. Now, it depends mostly on the family history or your risk level. Generally, cancer screening depends on age, your risk level, your gender, because some cancers occur in men, others in women, others in both, the type of test, and then the frequency. Generally, cancer screening guidelines are based on the population or average level of risk, not individual risk. That means that if cancer or other medical conditions runs in the family, you become a special case and you need a personalized plan. So generally, if you're above average risk, you require a personalized plan, whereas if you're average risk, then you don't require a personalized cancer assessment scheme, and I'll be explaining this. Most common cancers, especially cancer of the breast, colorectal cancer, cancer of the stomach, and prostate, as well as certain medical conditions such as Alzheimer's disease, diabetes, heart disease, and migraines, are genetically based. That means that if a close relative has been diagnosed, you may have an inherited predisposition to develop that cancer, and that means you require a personalized cancer screening schedule. So let me talk briefly about what it means to know your family history of cancer. Basically, taking your family history means sitting down with your parents and grandparents and other close relatives and asking them about their illnesses, and then you write it down. Now you can look at questions like age, at what age cancer was diagnosed. If cancer was diagnosed, let's say in the 20s, another person in the 60s, then the earlier it's diagnosed, it means the higher the risk in your family. The second question to look for is what type of cancer was it? Was it cancer of the skin, cancer of the colon, cancer of the lungs, or the breast? So the type of cancer needs to be recorded. And then what happened to the relative? Was the cancer aggressive? Did they respond to treatment and live longer, or did they die? So all these questions are very, very important, because when you are being screened for cancer, they really help the doctor in terms of understanding your risk level. So this is just now a summary of cancer screening by age as well as risk level. Now, when you see red, it means that's above average risk. When you see blue, it means average risk. Green means just continue screening. So for example, red indicates the age at which you should start screening if you are above average risk. That means you either have a strong family history of cancer in the family, or some genetic disorders that predispose you to a given cancer. If you are not above average risk at any given time, you have to wait until where it's shown in blue, the average risk, that's when you start screening. For example, if I have a family history of colorectal cancer or a personal history of polyps, these are just growths in the colon, or if I have chronic inflammatory bowel syndrome, it means that I'm above average risk in red for colorectal cancer. It then means that my screening should start as early as 21 years and continue. If I'm at average risk for colorectal cancer, and that's where majority of the people will be, screening starts at 45 years. So remember, if you don't have any risk like family history, then screening starts at 45 years. That what I've shown in blue, and continues up to 75 years as shown in green. Now you need to take note of the frequency of screening tests, which I'll be discussing in a little while. So there are many tests that can look for colorectal cancer, not just colonoscopy. So screening can be done either with a sensitive test that looks for signs of the cancer in a person's stool, the so-called the stool-based tests, or with an exam that looks at the colon and the rectum using video and a camera, what you call the structural or visual test. Now there are three types of stool-based tests. The fecal immunochemical test, also called FIT, which is done every year. Then you have the Guaiac fecal occult blood test, which is done also every year. And then the multi-targeted stool DNA test, which is also done every 3 years. So remember, these two are done yearly, while this one can be done every 3 years. The visual or structural exam of the colon and the rectum include three tests. Colonoscopy, done every 10 years. We have the CT colonography, done every 5 years. And then the flexible sigmoidoscopy, done every 5 years. It's important to remember that if a person chooses to be screened with a test other than this one, the colonoscopy, any abdominal test results should be followed up with a colonoscopy to confirm. Now, as I mentioned, exercise plays a very big role in either preventing your risk, reducing your risk of cancer. When you talk about exercise, it's important to remember that there's not one way of exercising for reducing your cholesterol, for reducing your blood pressure, for reducing your weight, or for reducing your risk of cancer. The amount of exercise is basically the same, and it's divided into moderate as well as intensity physical activity level. Moderate intensity activity is typically defined as brisk walking, cycling a bicycle, or running up and down a staircase, typically characterized by fast breathing, but the person is able to talk. Vigorous intensity activity refers to aerobic dancing, jogging, running, swimming, or cycling uphill. It's characterized by a fast heart rate and fast breathing, and the person is not able to talk. Now, if you're doing moderate intensity activity, you require 150 minutes per week, which can be divided into 30 minutes per day for 5 days a week. So you can do Monday, Tuesday, Wednesday, Thursday, Friday. Now, even the 30 minutes per day can be divided into bouts of 10 minutes. So you don't have to do 30 minutes continuously. You can do 10 minutes in the morning, 10 minutes in the evening, and then 10 minutes some other time. If you're doing vigorous intensity activity, you require 75 minutes, what I've indicated here. Now, for vigorous intensity activity, you can do it, it can be done for 3 days a week, as long as you do not go for more than 2 days without activity. So you can do like Monday, Wednesday, and Friday, and then continue Monday, as long as you skip 1 day and don't go more than 2 days without activities. In addition, all adults require muscle strengthening at least 2 days a week. And finally, you need to minimize the time you spend sitting sedentary, either sitting in the office or watching television or that kind of thing. Remember to break down your sitting movements in bouts of 20 to 30 minutes. Now, let me give you the answer to our quiz. The quiz was excessive alcohol intake has been linked to the development of all of the following types of cancers except, now all these cancers are mouth and throat, liver cancer, breast cancer, and colorectal cancer are linked to alcohol intake. Endometrial cancer is not linked to alcohol intake. So please just remember that. Now let's go through now the facts and myths and give you the answer. The first thing people saying colorectal cancer isn't a big problem after all. Now this is false. We say that colorectal cancer is the third most commonly diagnosed cancer globally. And in 2020, there were about 1.9 million cases diagnosed in both male and female. The second statement, it's possible to prevent most cases of colorectal cancer. I said yes. This can be done through early screening as well as reducing your lifestyle choices risks. If I'm not feeling well, I don't need to be screened for colorectal cancer. Now, this is false. Remember, we said that in most cases, there are no symptoms. And the sooner you get screened, it's the easier it is for treatment. Then fourth, lifestyle choices such as alcohol, exercise, smoking, and diet have an impact on the risk. That is true. These lifestyle choices impact your risk of developing cancer of the colon. Most people should start screening for colorectal cancer at 45. Then this is actually true. Remember, most people are average risk. So you start screening at 45 up to 75. People with above average risk, this is those who have family history of colorectal cancer where a close relative like parent, sibling have had colorectal cancer, they can start as early as 21 years. Finally, colonoscopy is the only test used to screen for colorectal cancer in patients with symptoms. Now the answer here is false. There are also stool-based tests that can be used for screening for colorectal cancer. So thank you very much for listening. My name is Dr. Biri Ogogo. I'm a medical doctor and specialist in public health medicine. I'm also the host of this podcast. Please remember to share this with your friends and family and also to subscribe to my YouTube channel. Until next time, bye-bye.